I am a speech-language pathologist specializing in cleft and craniofacial speech disorders. And in these first few months of life, you are receiving so much information from feeding to surgery and so much more. And I know that speech can seem like just one more thing you need to learn about. But you don't need to worry, because in this video, I'm going to tell you the basics of everything you need to know and expect if you have a child with a cleft lip or palate.
Welcome to Gab and Grow. My name is Gabrielle, and as a pediatric speech-language pathologist, I want to help you help your child connect with you and the world around them to grow into the person they are truly meant to be by nurturing their speech, language, and learning. The best therapy begins with you, so I hope you learn something new and consider subscribing.
In this video, I want to speak to you as someone who is just very passionate about this topic, and I want to try to break things down as simply and casually as possible so that hopefully it's something you can understand very well and be comfortable and confident speaking about. So first, I'm going to explain who this video applies to. Next, I will briefly describe what we expect children to be able to say and do in the first few months and years of their life. And yes, this is still very important, and especially important for children that are born with a cleft palate. Third, I will describe how a cleft will affect the speech of a child born with a cleft palate. And last, I will describe what you can do to help your child stay on track with their speech. Before we begin, I need to emphasize the importance of having a cleft team follow your child's development. A cleft team will have certain professionals that all work together to make sure that your child's care is managed appropriately. You can see every single cleft team and filter by location on this website, which is managed by the American Cleft Palate Craniofacial Association, and you can access this by clicking the link in the description below. Treating the speech of children that are born with a cleft palate can be complex, and there may be many exceptions and nuances to the generalities that I will describe today. So I will describe how a cleft will affect a child's speech in general so that you're informed, but make sure to stay well connected with your cleft team. So number one, who does this video apply to? This video applies to children that are born with a cleft palate. If your child is born with only a cleft lip with no involvement of their soft palate, then there are no cleft-specific speech concerns that you should have. Now, a child that's born with a cleft lip could still have any speech concern that any child could have. So it's still important that you're aware of speech milestones and how their speech is developing. But for today, I am speaking specifically to parents of children that are born with a cleft palate. And if you're not sure, then just stay tuned, because I will go over anatomy a little later in the video. Next, it's important that you understand speech milestones in general before we describe how a cleft will affect your child's speech. So sometimes, in my experience, it's sometimes common for parents to maybe expect their child to do a little less when it comes to speech because of their child's cleft, or maybe they might expect their child's speech to develop differently, and so they don't exactly stimulate them in the same way they would if their child did not have a cleft palate. Or if their child's speech is developing differently, then they may sort of see that as expected because of their child's cleft palate, and they may not seek the same intervention because maybe they're thinking that it's expected because of the child's cleft. And for this reason, I want to be very clear about what to expect. After your child's cleft palate is repaired, I want you to expect normal speech skills and normal speech sounds. That is the expectation. I'm not saying that will definitely be the result. Just like for any child, you expect that their speech will develop normally, and sometimes it doesn't. So again, after a child's cleft palate is repaired, you can expect normal speech development. However, a child that's born with a cleft palate is at risk for certain speech concerns that are specific to their history of a cleft palate, and I am definitely going to describe these in detail a little later in the video. For now, let's just briefly describe some normal speech milestones so that you know what to expect and look for, and you also know what to compare your child's speech development to. These are some normal speech milestones. Between 2 and 4 months, you can expect your child to start cooing, which is when they just turn on their voice and start playing with their voice. So you'll start hearing them make sounds like ah, not necessarily moving their mouth to make speech sounds and consonants, but at least playing around with the sound of their voice. Between 4 and 6 months, you should actually start to hear your child start to make some speech sounds, which will just sound like ba and da, starting to actually use their articulators like their lips and their tongue to make some true consonants. And they're not using words yet, but they're actually just playing around with the sounds we use to make words. Also, between 4 and 6 months, maybe a little bit on the later end, you can listen to them start to put some of these sounds together in strings. This is what we call babbling in strings, like when they're not just making one sound every now and then, but they're actually stringing it together, like ba 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 or da da da. By their first birthday, you can expect them to produce gestures like waving hi. You can also expect them to begin saying some of their first words, maybe between 1 and 5 words around their first birthday. And these will be very simple words that they have heard over and over again, like hi and bye, maybe mama or dada. Then a lot happens between their first and second birthday because at 2 years old, we expect them to be producing 50 words and starting to put two words together. Some of the first speech sounds to develop are going to be the sound for the letters M, N, T, D, P, and B. So these sounds are n, t, da, ba. If you want to learn more about developmental communication milestones, to know more about what to expect and what to look for, then for free down in the description below, I have a roadmap of communication from birth to 5 years old so that you can see that big picture from when your child just starts making sounds with their voice all the way to when they're entering kindergarten. So again, these are what you should look for in your child, even if they have a cleft palate. So let's think about it like this. If your child is born with a cleft palate, there's basically 3 things that can happen. Number 1 is that nothing will really happen and that their speech will develop as we normally and developmentally expect it to. They might make some mistakes when they begin to talk, but that is all developmentally appropriate. By mistakes, I mean those developmentally appropriate little mistakes that children make when they start to talk, like when they call their bottle their baba or something like that, but they quickly grow out of it. So that is for number 1. And in the category of number 2, your child could be subject to any speech issue that any child could have, totally unrelated to their cleft palate. Maybe they are a late talker and their language development is just a little delayed, or maybe they could have trouble saying their R sound when they get older. This could be literally anything. And I'm mentioning this just to remind you that when you go to a follow-up appointment with your cleft team, and let's say that they tell you that the palate is working great and that there are no concerns you should have about the function of the palate for talking, it doesn't mean that your child's speech will be perfect and that there are no concerns at all you should have. There might just be a general like articulation concern that they could have, and it's unrelated to the cleft, but it should still be treated. Or let's say that your child does have a speech concern that you're aware of. Let's say that they have a lisp or something like that. Because the child has a cleft, you might be thinking that any speech concern that they have is related to the cleft. And that's not necessarily true. It could be unrelated to the cleft. And in the third category, your child could have a speech concern that is related to their history of having a cleft palate. One possibility here is your child having speech articulation errors that are unique to a cleft palate, and I will go into detail about what this means. Or a second possibility is that your child's speech could sound what I will call nasally, or you might hear the term hypernasal. And that is because they might have air or sound coming out of their nose when it's not supposed to for speech. And if you're not sure what I mean by all of this, then don't worry, because I'm going to describe it in detail now in the next section, which is how a cleft palate can affect the speech of a child. But in order for you to really understand how a cleft palate can affect your child's speech, you need to understand the role that the palate plays in their speech. Let's take a glance at this picture. So this is the child's lips. This is the child's nose. This is the tongue. This is the back of the throat. This is the hard palate. This is the soft palate. You can lift up your tongue to the roof of your mouth and feel the hard palate where it's sort of bumpy on the roof of your mouth. And then if you keep your tongue on the roof of your mouth and just slide it back, you'll feel where it goes from hard to soft. and that soft part is your soft palate. Let's stay focused on the soft palate for just a moment. The soft palate has a very important role when we talk, and its job is to move back and up and close off against our throat when we talk, so that air and sound do not escape out of our nose. So again, when we talk, for most of our sounds, our soft palate moves up and back against our throat so that air and sound do not come out of our nose when we talk and instead come out of our mouth. And these three pictures demonstrate exactly what this looks like. In the first picture, you can see that the air goes through the mouth and through the nose for breathing because the soft palate is at rest, meaning it's sort of just hanging. It's not moving up and back. It's just at rest, and therefore, when the air moves up from our lungs, it's going to come out of our mouth and out of our nose. It can also come into our mouth and into our nose and go back to our lungs. When the child makes all of these sounds, it moves back to touch the back of the throat so that air is no longer able to escape out of the nose for talking. Another word for throat that you might hear is the posterior pharyngeal wall, meaning that the soft palate has to close against the posterior pharyngeal wall. And sometimes you'll see people describe it with their hands like this. So if this is the hard palate, this is the soft palate hanging at rest in the back of our mouth. This is the throat, or the back of the throat, or the posterior pharyngeal wall. And what happens when we talk, when we say the sound "ba," for example, you may see people show you with their hands like this. So they'll show you "ba." It moves up and back, and then it comes back to rest. The only exception to this, which you can see demonstrated here during nasal sounds, is that there are 3 sounds in the English language which do have sound come out of the nose. And this is normal for everyone. This is how these sounds are supposed to be made. And these are the sounds like and ng, as in ring. So in, and then the sound. So I want to take a better look at the soft palate in action with you. And I want to offer a special thanks to Speech Graphics for making this fantastic video.
Bean, beat, bends, boy, budge.
So that was a B sound, and you see how the soft palate lifts up and back against the back of the throat to make sure that no air and sound are able to come out of the nose, and you can see that the air and sound come out of the mouth instead. And now you can see how the soft palate is still moving up and back for a variety of other sounds, like the ch sound and the z sound.
Bends, cease, chip, chops, coat, coil, coin.
Now in that word coin, you can see how the soft palate moves back down so that the sound can come out of the nose for the letter N. If the soft palate cannot close off the nose in the way that it needs to for speech, then this is called velopharyngeal insufficiency. Another term is velopharyngeal incompetence, and these mean the same thing. It is often shortened to VPI. And now I'm going to break down this term for you so that it makes perfect sense. The part of the word velo is short for velum, and this is another term for the soft palate. The part of the word pharyngeal refers to the pharynx. Remember, I called the back of the throat the posterior pharyngeal wall. The pharynx is another word for throat. So velo refers to soft palate. Pharyngeal refers to throat. Soft palate, throat. And then insufficiency. And this means that these two things, the soft palate and the back of the throat, working together in their current state, are insufficient for speech. And right now you might be wondering, well, how do I know if this is the case for my child? Don't worry, we are going to get there and you're going to understand by the end of the video. So I want you to think about what will happen if the soft palate cannot touch against the back of the throat to make sure that no air and sound come out of our nose when we're talking. So there are 2 potential outcomes of this that we're going to explain. And obviously children will not be able to make the sounds for P, B, T, and D like they would if their soft palate was functioning properly. So one outcome is that the child could develop compensatory speech articulation errors, and these are sometimes also called maladaptive speech articulation errors. The reason why I'm giving you these different terms is because when you look into this information yourself, there are a lot of different terms and a lot of information out there. So I'm just trying to make sure that as you do your research, you're going to be fully informed. Compensatory speech errors are when children start to produce speech sounds in atypical ways because they're trying to compensate for the fact that their soft palate is not fully touching against the back of their throat to help them produce the sounds correctly. And because of this, they may actually start using their throat or their nose to make sounds. One example of a compensatory speech error is called a glottal stop. And this is when a child uses their throat to make speech sounds. Now I'm going to show you what this might look like. If a child were trying to say baby with a glottal stop or the B sound, it might sound like this. A-E. Or a child might even sometimes put their lips together and use a glottal stop to actually produce the sound. And it might look like this. Me. This is just one of many compensatory speech errors, and you need to make sure that you're working with a speech language pathologist with education or training in craniofacial speech disorders to identify and treat them. And so if you're wondering how do we actually correct these, the way to treat compensatory speech errors is with speech therapy. If a child has VPI, then the way to correct this is with surgery. A child will not be able to learn how to move their palate up and back if there is a structural limitation to doing so. And so again, if the child does have BPI and they're not able to have their soft palate move up and back to completely close off against the back of the throat, then that child may need surgery in order to correct this. And that is a very important conversation to have with your cleft or craniofacial team. A child could make these compensatory speech articulation errors even if their soft palate is working for speech, meaning their soft palate is able to move up and back and close against the back of the throat for speech, and they do not have BPI. A child could still have these compensatory speech errors due to their history of having a cleft palate. So just because a child has compensatory speech errors, it doesn't automatically mean that they have BPI or that their soft palate doesn't function as it needs to. A speech language pathologist on your child's cleft team will be able to tell you if your child's palate is working properly for speech. The second possible result for speech of a child with a cleft palate, if their palate is not touching against the back of the throat for speech in order to close off their nose, is that too much air and sound will come out of their nose when they try to talk. This could look like a child putting all of their articulators in the right place when they speak, meaning their lips, their tongue, everything in their mouth is in the right place to try to talk, but it's just that too much air and sound comes out of their nose when they talk, and so the result is that it sounds hypernasal, or we can simply just hear the air escaping out of their nose, and we actually call this nasal air escape. And you might be wondering, well, how do we correct this? The way to correct too much air sound coming out of our nose when we talk, resulting in hypernasal speech, or nasal air escape, meaning you can hear the air coming out of the nose when we talk. The way to correct this is with surgery to correct the velopharyngeal insufficiency. The reason why speech therapy is the treatment for compensatory speech errors is because these are like learned speech articulation errors. No matter what you do, the child has to relearn how to make the sounds the correct way. The reason why surgery is recommended for hypernasal speech or nasal air escape that cannot be corrected by the child is because the child is not able to stop the air from coming out of their nose if there's a structural limitation. No matter what they do, they're not going to be able to stop too much air sound coming out of their nose if their soft palate cannot physically touch against the back of the throat. But all of this is not for you to worry about. When you go to your follow-up visit with your cleft team, they will let you know how your child's speech is developing. And that's why in the beginning of this video, I emphasize the importance of staying well connected with your child's cleft or craniofacial team. And this is where you come in. Now I'm going to share with you what you can do to make sure that your child's speech is on track. So when you go to check in with your child's cleft team, maybe around 15 or 18 months so that they can evaluate your child's speech development, it's important that your child is actually trying to talk so that they have something to evaluate. meaning if you go in and they ask you certain questions about the sounds your child is making or what words you hear and what they sound like, if your child isn't producing words yet or sounds yet, then it might be difficult for them to actually tell you how the soft palate is functioning for their speech. 4 critical sounds that tell us about how your child's speech is developing and about the function of their palate is P, B, T, and D. And this is great because these are some of the first sounds that your child develops. So if you can help them be able to hear these sounds a lot so that they can begin to produce them, that will help them have an advantage when they come to an evaluation to find out what needs to happen next in their care or to confirm that their soft palate is working properly. So it can be really helpful if you do everything you can to help your child be able to produce these specific sounds so that we know if they're able to say them or not. You can help them develop skills and milestones that help your child produce sounds and words on time. I won't go into each and everything that you can do to help your child develop early speech skills and milestones, but the good news is that I do have an entire video describing these, which I will link down in the description below, and you can watch it there if you're interested. These are things like using lots of repetition of words and using wait time for them to have some extra time to respond to you and other things like that. But for now, let's focus on those sounds that we want your child to be able to produce because they tell us a lot about your child's speech, how it's developing, and the function of the palate. So again, these sounds are P, B, T, and D. I'm going to run through these kind of quickly to be comprehensive about it. There's so many different examples that I could give you, and I could be much more specific about how to use these examples. If you want more videos on things like this, please let me know down in the comments. For the B sound, there is just so much you can do to stimulate your child to help them produce this sound. There's so many fun books, activities, and games and songs. Some books that come to mind are Brown Bear, the book Baby Beluga. I'm sure you can think of some as well. Maybe another one is Bingo, because every time you go through and spell bingo, B-I-N-G-O, and then you can pause and wait for them to say B-I-N-G-O, pause, B-I-N-G-O, and Bingo was his name. Oh, those sorts of pauses, letting them say the word with the B sound. A lot of children's favorite words start with a B, like bye-bye, or baby. These are some other easy words that you can help your child learn to say. Another one is the song, I'm Bringing Home My Baby Bumblebee. This is a really fun one, and it's just loaded with B sounds. It also provides the opportunity for you to pause again and let your child say one of the words that starts with a B. So I'll show you how you can do this. You could say, I'm bringing home my baby Bumblebee. Won't my Mama be so proud of me? I'm bringing home my baby Bumblebee. That's how you can do it to help your child say that sound. There are so many more examples that I could give. I probably don't need to tell you that you can use a ball for a keyword. Another one might be a boat, just revolving their play and their toys around these sorts of words that start with a B or any of the other sounds we're going to discuss. For the P sound, you can do lots of bubbles. That's another B word that children often love is bubbles. But now that we're focusing on P, after you blow the bubbles or use a bubble machine and make so many bubbles, every single bubble is an opportunity to say pop. And every opportunity to say pop is the opportunity to help your child say the P sound, which does tell us something about how your child's palate is working for speech. You can also use some tissue paper or a tissue, get a little bit of it and put it in front of your mouth and make a bubble with your cheeks and make the sound and watch it move. Children love anything that is visual. And so after you show them this, then you can give them a turn and see if they can make it move. You can also save the packing peanuts that you get in your packages, put it in your hand, bring it up to your mouth or their mouth and do the same thing and see it move. You could also put one of these on top of something. So that way it's not in your hand. It's a little bit more fun for them to just put it on top of a water bottle or anything like that and then make it fly off. You can have competitions with them to see who can make it go further to make it a little more interactive. Some other common words for children that are sometimes in their list of first words is open and up. And of course, these do have that letter P that we want them to say. So you can help them learn these words in all of your activities. The great thing about these two words is that you can really work them into any activity that you're doing. If you have a bag of anything, could be their food, it could be a game, could be literally anything that you want to use, you have to open it. So another word that is very common is pull. So you're constantly pulling something, whether you're pulling it out of a box or you're pulling a zipper on a bag or their jacket, you're just pulling all the time. So you can just use that target word, pull, and help them pull. We're going to pull it open and really emphasize that P sound. Things are always moving up, or maybe they reach up their hands to say that they want to go up and be held. You can teach them up and down, so many different ways to incorporate these words in their play. Some other common words are pink and purple. So especially if you have some options for them, you can give them the two options, pink or purple, and help them make a choice. While they're doing that and they say the word, you find out a lot about if they can say the P sound. Let's move on to the T sound. Another word that you can use for teaching this sound and helping them produce it are putting something on top. So you can hear that T sound in that word. You could put it on top of your head. When you're using the toy cars, you could put one on top of something. Often with the ball ramps, you have to put it on top. You can find any reason that you could help teach this word and teach them to use it. So you can find out a lot about that T sound and how they're saying it. Another thing you could do is play around with the sound that the clock makes. You can say, t, t, t. It's the sound the clock makes. See if they can make that sound. Children sometimes like making sounds for things before they are actually willing to say a word for you. What I mean by this is they might be willing to say when something's yummy, or say t, t, t for the clock, or say vroom for the car, and just make sounds for things like animals. They sometimes might just gravitate more to sounds for things, so you can try this as you're helping them say the T sound. Also, when you're giving them two choices, you can ask them, do you want one or two? This is just how you can label the two different things that you have. And anytime that they choose number two, you are seeing if they can say that T sound when they produce the word. So a pro tip is always put what they want as number two, so that they're always getting an opportunity to make their T sound. For the D sound, I'm going to give you a couple quick tips. One is the Baby Shark song, Baby Shark, do, 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 do. You're hearing that D sound over and over again. See if they can copy it. Obviously, dada is going to be a popular one, and you can also try words like duck or dog. And the last tip I have for you about how to make sure your child's speech is on track if they were born with a cleft palate is just to be aware of how the palate works for speech, so you know what to look for. And you can go ahead and check that one off because you have almost finished this video. And I hope that now you are much more informed about what the role exactly is of the palate for speaking and how you can help be on the lookout for certain developmental milestones for your child. Thank you so much for watching. Remember that you are your child's biggest advocate, and staying informed is one of the best things that you can do for them. You've got this. Please remember that I am here for you along the way. If this was helpful to you, be sure to check out the resources that are linked down below and let me know if you'd like more videos on this topic. I hope that you will subscribe, like this video, and share it with a family who may need this same support.